Interventions with a King. Discussion and commentary based on articles from Jack, Cardiovascular Interventions.
I'm Spencer King from Jack Intervention, and I'm having a conversation today with Dr. Mark Reisman from Seattle, Washington. We're going to talk about a paper that Mark has analyzed and written a nice editorial about for the journal. Mark, welcome.
Thank you very much.
Listen, this paper has to do with PFO closure and preventing cerebral events and so forth. It's by the group from Mayo Clinic, Dr. Ford and Dr. Reeder. Tell me, what it's true that a great number of people have patent foramen ovale, and some of them have events. And this study from Mayo took people that had some kind of event and reported a very large series in their results. What was your take on this? Is this I'll come to the question about what we should be doing, but what was your impression of that study?
I think it was a very good study with regard to trying to identify a subset of patients. Generally, they were younger, in their mid-50s, and they had fairly good assessment as to potential etiology of the neurologic event of the stroke or TIA. Once all the traditional risks were ruled out, they then targeted the PFO. And irrespective of actually the size of the PFO, they made a clinical decision with consultation with neurology to use PFO closure as a treatment.
Now, they found some relationships to other things with the events, didn't they? And when we're working up these patients, what needs to be done to make sure that you're on the right track, or there's not some other contributing factors?
The challenging part with cryptogenic stroke, obviously, and basically targeting the PFO is that we often don't find the criminal. We don't find the trigger. We very often don't find clot or either in the legs or in the PFO itself. So we really try to almost use surrogates. So what they did was they did obviously transthoracic echo and transesophageal echo. They did a workup for thrombophilia. In addition, they looked at other potential causes for the event. But they did find that in the recurrent group, there was a significantly increase in the patients with thrombophilia, and interestingly enough, with elevated right heart pressures.
Yeah. So it raises a question about whether there's a complete closure of the PFO. Is that? I mean, I guess if you have a elevated right heart pressure, does imply that maybe that could have something to do with. Did they have any correlation with documentation that the PFO was completely closed or not?
At follow-up, they did do predominantly transthoracic echo as a follow-up. And interestingly enough, in the patients that had recurrent events, all the PFOs were completely closed.
Is transthoracic good enough to prove that?
I don't think so. The sensitivity is unfortunately fairly low. At our center, we use what's called power M mode transcranial Doppler. It's probably oversensitive, but at least it captures all the patients potentially that might have residual shunt. And then ultimately, we could adjudicate further with transesophageal echo. But having said that, we have seen in our work and publications that a small residual shunt does not appear to be related to an increased risk of a recurrent event, either stroke or TIA.
So this paper was a large series, 300 plus patients who had closure. What should we be expecting if you do close a PFO, if you have a cerebral vascular event? What do you expect in terms of event rates going forward?
Right. So if you take the data that's available now, they should be somewhere in the range of about 2%. Unfortunately, the data is often retrospective. It's often non-randomized. And even the meta-analysis, which are often quoted frequently, unfortunately are based on non-randomized studies and also retrospective. So generally, we like to use meta-analysis to look at randomized trials and get more power. But really, we're walking on fairly soft surfaces here in terms of using the data.
So these are observational studies. How long will it be before we get a definitive answer about whether we ought to be closing all these PFOs?
Well, the exciting part about this study was that the majority of the events occurred within the first 2 years. The study that was just completed, called Closure 1, which was a randomized, multi-center study comparing PFO closure to medical therapy, had its primary endpoint at 2 years. So we're very excited that that's completed. We're in a follow-up phase now, and hopefully that will give us that solid direction that we need to go forward to manage these folks.
Well, we'll be very interested in hearing about Closure 1 and getting some answers from that study and the other one that's to follow, and finally maybe put this to bed as to whether we ought to be closing all these PFOs or not. Mark, thanks a lot for visiting with us.
My pleasure.
Here on Jack Intervention Conversations.
Appreciate it. Thank you.